Lesson 5, Growing Strong, Nutrition and Feeding Practices in the NICU. In this lesson, I will guide you through the journey of NICU nutrition and feeding practices. As a parent, sitting by your baby's bedside in the NICU, you may have concerns about how your baby will receive the necessary nourishment to grow and thrive, regardless of how early they are born. And you have every reason to be concerned, because your baby's growth and well-being depend on their ability to eat. However, when your baby is in the NICU, there may be delays in feeding, especially if they require respiratory support. I'm here to help you grasp how babies receive their nutrition in the NICU, ensuring that you have a clear understanding of this vital process. IV fluids. During pregnancy, babies receive all the necessary nutrients from their mother through the umbilical cord. After birth, breastfeeding is usually started promptly to ensure continued nutrition. However, if your baby requires NICU care, they might not be able to breastfeed immediately. In such cases, they will receive nutrition through IV fluids administered by a PIV, umbilical line, or PICC line. There are different types of fluids that can be given to your baby through the IV to help meet their nutrition needs. These fluids include dextrose, TPN, and lipids. Dextrose is a solution that contains sugar and water to help your baby keep their blood sugar levels stable. Depending on your baby's blood sugar levels, they may receive different concentrations of dextrose. TPN, or total parental nutrition, is a sterile solution that provides all the nutrients your baby needs, including sugar, electrolytes, carbohydrates, and protein. It is usually yellow in color and comes in an IV bag. Lipids are a source of fat and provide important calories and fatty acids for your baby's growth and development. They're usually seen as a white substance hanging from the IV pole or attached to the IV pump. The importance of breast milk. Providing breast milk for your baby is a natural and beautiful way for a mother to provide nourishment for her baby. It is often encouraged as the best way to feed a newborn, as it provides a wide range of benefits for both mother and child. Breast milk is a complete source of nutrition containing all the essential nutrients that a baby needs in the right portions. It also contains antibodies that help protect babies against infections and illnesses. For babies that are born prematurely or require special care, breast milk is even more important. In the NICU, the focus is on providing the best possible care for the baby, and this often includes encouraging mothers to breastfeed if she is able. Breast milk is tailored to the unique needs of each baby, and it can help support their growth and development during this crucial time. While breastfeeding and pumping can be a wonderful experience, it can also be challenging for some mothers. It takes time, patience, and practice to establish a good breastfeeding routine. Many mothers may experience difficulties with latching, milk supply, or other issues. In the NICU, mothers may face additional challenges, such as the need to express milk and provide it to their baby through a feeding tube. If breastfeeding is not possible or not desired, formula feeding is a perfectly acceptable alternative. Formula can provide all the necessary nutrients that a baby needs to grow and develop, and is often easier for some mothers to manage. In the NICU, formula is readily available, and the staff are experienced and knowledgeable about different types of formula. It is important for mothers to remember that the most important thing is to feed their baby, whether it be through breast milk or formula. The NICU staff are there to provide guidance and support and to ensure that the baby is receiving the best possible care. Mothers should also take care of themselves during this time, both physically and mentally, as this can have a positive impact on their ability to breastfeed or manage formula feedings. Pumping and storing breast milk. If your baby is in the NICU and you're unable to breastfeed them, don't worry. There's still methods to provide your baby with the nutrients they need. The best method is to pump your breast milk and begin storing it for your baby. It is essential to begin stimulating your breast as soon as you deliver, even if your baby is not immediately able to breastfeed. You may use hand expression to start stimulating your breast, and once you are in your postpartum room, a hospital-grade breast pump will be provided to you by your nurse. It is recommended to pump every 3 hours, even if you're only able to collect a few drops of colostrum. This is the first milk produced by the breast during pregnancy and right after delivery. By frequently stimulating your breast, it will help establish your milk production. Your milk will be collected and stored by the NICU team, and when your baby is ready to eat, your milk will be given first, followed by supplementation until your milk supply increases. If you don't produce enough milk in the beginning, don't worry. With time and consistency, you will eventually get there. It is also essential that you take care of yourself during this period. Rest and make sure you eat and drink plenty of fluids to maintain your milk supply. If you pump in your room, you can immediately bring it to the NICU, or you can store it for later use. Breast milk is good at room temperature for 4 hours, and fresh milk stored in the refrigerator is good for 4 days. If your baby is in the NICU for an extended period of time, you can freeze your milk and bring it to the NICU the next time you visit your baby. Frozen milk is good for up to 6 months in a traditional freezer and up to 1 year in a deep freezer. The NICU nurses will store your breast milk in a designated refrigerator or freezer within the unit. If your hospital has a milk bank for NICU babies, your milk will be picked up and taken there. The milk bank serves as a storage facility for breast milk for mothers whose babies are in the NICU. At the milk bank, your baby's milk will be prepared for the day and then delivered to the nurses in the NICU. Throughout this process, several checks and balances are in place to ensure the proper handling of your milk and for your baby's well being. Remember, you're doing an amazing job, and your efforts are crucial for your baby's well being. Keep pumping, rest well, and take care of yourself. Donor breast milk. For new mothers, it's important to know that breast milk production takes time. During this period, donor breast milk can provide valuable nutrition for your baby. To qualify, specific criteria on your baby's weight, age at birth are considered. Typically, babies born before 34 weeks or weighing less than 3 pounds and 5 ounces are eligible. Babies with certain digestive issues may also qualify. The hospital receives donor breast milk from milk banks located throughout the state, where generous mothers donate their extra breast milk to help NICU babies. This act of kindness can make a significant difference in your baby's life. When a mother donates her breast milk, it is carefully screened, processed, and stored in a human milk bank to ensure that it is safe for consumption. Human milk banks take great care in screening their donors, ensuring that they are healthy and free from infection or diseases that could be passed through their milk. Once the milk has been collected, it undergoes a thorough process and testing protocol to ensure that it is free from any harmful bacteria or viruses. If your baby does not qualify for donor breast milk, there's no need to worry. They will still receive proper nutrition through formula until your milk production increases. This ensures that your baby receives the essential nutrients required for their growth and development. As your milk production increases, your baby will receive a combination of breast milk and formula. Although feeding your baby may be a demanding task, it is also a rewarding journey. You will witness your little one grow and thrive, knowing you are doing everything in your power to help them grow along the way. As parents, take heart and rest assured you are doing everything right for your baby. Fortified breast milk. Breast milk is a great source of nutrition for babies as it contains all the essential nutrients they need to grow and develop. However, some babies may require extra calories and nutrients to help them grow properly. This is especially true for premature babies or babies that have difficulty gaining weight. If your baby requires additional nutrition beyond what breast milk alone can provide, their healthcare provider may suggest fortifying the breast milk with a specialized supplement known as human milk fortifier. This supplement is specifically formulated to enhance the nutritional content of breast milk by increasing the calories and nutrients. By adding a human milk fortifier, your baby can receive the optimal amount of nutrition, including increased protein, electrolytes, and essential fatty acids. Human milk fortifier is commonly used in the NICU to help premature babies grow and develop properly. It's carefully measured and mixed by a healthcare professional to make sure your baby is getting the optimal amount of nutrition. If your baby needs human milk fortifier, the healthcare provider will explain how it works and how it can help your baby grow and develop. They will also monitor your baby's weight and growth to ensure that they are receiving the right amount of nutrition. Trophic feeds. When a baby begins feeding in the NICU, they may begin feeding with what is called trophic feeds. This process involves introducing small amounts of breast milk, donor breast milk, or formula through a feeding tube. When your baby is born early, their digestive system is not fully developed, and it may take some time before they are able to tolerate larger volumes of milk. Trophic feeds help slowly introduce milk into your baby's intestines, allowing them to adjust to the process of digestion. These feedings are especially important for premature infants as their tiny bodies are not yet equipped to handle large amounts of food. However, even term babies benefit from trophic feeds if they are having trouble tolerating regular feedings. It is important to note that feeding tolerance can vary from day to day, and it is not unusual for a baby to tolerate their feeding one day and have trouble the next. Your baby's digestive system is still developing and learning its new job of processing nutrition. This is where the expertise of a NICU nurse comes in, as they carefully monitor your baby's response to feeding and alert the neonatologist if any issues arise. Bottle feeding. In the NICU, it is important to pay attention to your baby's feeding cues to determine when they are ready to eat from a bottle. Cue based feedings is a term used by the NICU staff to describe this approach, which involves observing a baby's behavior and actions to determine if they are ready to feed. Feeding cues can be subtle, but they are important indicators that the baby is ready to eat. Some common feeding cues include a baby's fists moving to their mouth, head turning to look for the breast, which is called rooting, becoming more alert and active, sucking on their hands, lip smacking, and opening and closing their mouth. It is important to note that a baby may not exhibit these signs at every feeding, and that's okay. The key is to pay attention to the individual cues and respond accordingly. By bottle feeding your baby when they are showing the feeding cues, you can help ensure that they are ready and willing to eat. This can promote better feeding outcomes, overall growth, and development. If you have any questions about feeding cues or need support with feeding your baby in the NICU, don't hesitate to speak with your baby's care team. They can provide you guidance, resources, and support to help you navigate the feeding process and ensure the best possible outcome for your baby. When your baby is in the NICU, their ability to feed may be impacted by the amount of breathing support they require. If a baby is on a high amount of respiratory support, such as CPAP or a breathing tube, they will not be able to safely bottle feed. However, if baby is on a low amount of oxygen and is able to breathe with no breathing support, their care team may decide that it is time for your baby to start learning to feed from a bottle. The process of learning to feed from a bottle can be a gradual one, and your baby will be carefully evaluated for their readiness for this step. The baby will be assessed for their ability to suck, swallow, and breathe simultaneously. Based on this assessment, an appropriate bottle will be provided for them to use. It is important to note that feeding in the NICU is a highly individualized process, and every baby's journey will be unique. The care team will work closely with parents to determine the best course of action for their baby and provide support and guidance along the way. Breastfeeding in the NICU. As a parent, one of the most important things you can do for your baby is to provide nourishment and support, especially when they're in the NICU. When your baby is off respiratory support and is medically cleared to begin breastfeeding, you can start to breastfeed them. All you need to do is follow your baby's feeding schedule and let the nurse know you'll be there to breastfeed. If this is your first baby or you need assistance with latching, you can ask for a lactation consultant. The nurses in the NICU are also trained to help you with breastfeeding and are always there to offer support. After your baby has finished breastfeeding, they may or may not be supplemented with additional nutrients, depending on your doctor's orders. The supplementation is to ensure that your baby is receiving the calories and nutrients they need to grow and develop while they're in the NICU. Remember, it can take a few days for your milk to come in, so supplementing your baby's feedings ensures that they are getting everything they need to go home. While breastfeeding in the NICU, it's important that you feel safe and comfortable. The NICU team will provide you with screens and pillow support to make your time with your baby as private and intimate as possible. If you have any questions or need anything, don't hesitate to ask. The NICU team is there to support you through this journey. As we wrap up this lesson, it's important to acknowledge that feeding methods for babies in the NICU can vary. These methods may include IV fluids, tube feeding, bottle feeding, breastfeeding, or a combination of these methods. As we learned, every baby is different and may require a unique approach to meet their nutritional needs. As a parent, it's important to provide your baby with love and support they need as they progress through their feeding journey. You can work closely with your healthcare team to ensure that your baby's feeding plan is progressing smoothly and discuss any questions or concerns that you may have. Remember, while your baby is receiving the nutrition they need, your presence and support can significantly impact their growth and development. By being patient and understanding, you can help your baby develop the necessary skills to thrive and grow. I hope you enjoyed this lesson and thank you for joining me.